When the world was first warned about coronavirus, it was a crisis like that unfolding in India that scientists were worried about, and it's only intensifying. For the first time, more than 3,000 people have died in the country in a single day. There's also a new record number of cases, more than 360,000. That's the 7th day above 300,000. And yet the true numbers are likely to be far greater. Doctors and funeral organisers say that some COVID sufferers are not being counted in the mounting death toll. And criticisms of the government's response are growing. From Delhi, South Asia correspondent James Oaten reports.
This religious festival on the banks of the River Ganges has been going on for weeks. But even as coronavirus cases soar, there's still barely a mask in sight and no social distancing. The fear is that these kinds of gatherings will keep the virus spreading in a crisis that's only getting worse. In Uttar Pradesh, people are struggling to breathe. An offer of free oxygen at a Sikh temple brings some of the critically ill onto the streets. They've been turned away from hospitals and their families are desperate. Intensive care units everywhere are full. Doctors are struggling.
The situation is critical right now. This pandemic is the worst we have ever seen till now. And these 2 weeks are going to be a hell for us.
As frustration grows, relatives of the sick take out their anger on hospital staff.
My mother was admitted 3 days ago. Last night they said they don't have oxygen and told me to take her somewhere else.
As Delhi's crematoriums continue to run out of space, bodies pile up outside and empty parks are being used as makeshift cemeteries. Some families risk the virus to make sure their loved ones get a traditional send-off. Many don't believe the official death rates.
Delhi government says that 380 people are dying every day from corona, but it's actually around 1,000, more than 1,000.
There's many factors contributing to the underreporting. Crematorium workers and ambulance drivers say people are dying from COVID, but they're not being tested, so they're not included. Health experts say too often people are being recorded as dying from other illnesses instead of COVID, defying World Health Organization protocols. In many instances, this is a system that is just being overwhelmed. As concerned, political pressure is also to blame. Aid has started arriving from countries like Britain and Germany, ventilators and machines that will extract oxygen from the air. For many, it's too late, but the urgency in this crisis is only intensifying. James Oaten, ABC News, Delhi.
The decision to suspend flights between Australia and India has not only devastated Australians desperate to come home, it's also distressed those who are equally desperate to travel to India to help sick family members. The Australian government is vowing to reopen flights as soon as possible. Here's Foreign Affairs reporter Stephen Jedgetts.
United in sorrow.
Lord Jesus, heal them, deliver them from that sickness.
Melbourne's Indian community mourns the devastation back home.
I've been to so many friends' houses for condolences in the last 1 week. It's really depressing.
In the same city, Mano Rajamuthu is mourning her own private loss. Her father passed away in India last year.
When he passed away, I couldn't actually attend his funeral. Due to the travel restriction, I couldn't travel and be with my mom.
Now her mother is also gravely ill after a stroke, but Mano has been repeatedly refused permission to leave Australia to be with her. And the federal government's decision to suspend all flights between Australia and India has left her feeling even more hopeless.
I might not see her again. So it is very emotional. It is very difficult to face this type of situations. So we are here and they are there.
The government says it had to act because of the sheer scale of the calamity in India and the way cases were seeping into Australia. In Northern Territory quarantine facilities alone, 47 of the 51 active cases are Australians returning from India.
What I would say to Australians in India is that as soon as it is possible for us to look at supporting them to return to Australia, we will do so.
The hot zone's over there.
The government's also pressing ahead with expanding the Howard Springs quarantine facilities in the top end.
What that means is we'll be able to continue to bring our charter aircraft for our repatriation flights back into Australia from all around the world.
But the task is immense. More than 9,000 Australians want to return home from India, including 650 who are considered vulnerable.
The real question is, why weren't these Australians brought home when Scott Morrison said he would?
The government will review the flight ban next month, but there's no guarantee it will necessarily be lifted then. It's still not clear when this pandemic will peak in India, and balancing public health imperatives with the desperation and suffering of those separated from family members will not be an easy task. Stephen Jedgetts, ABC News, Canberra.